1, 2, 3. 1, 2, 3. More than 1/3 of the US population are obese. This would mean every third person sitting here would be overweighted. Obesity is a severe problem because there are many diseases related to it. Here are some examples of negative effects of obesity on your health and on your life. There would be heart diseases, strokes, diabetes, and not to forget, certain forms of cancer. That's the reason why obesity is one of the leading causes of preventable death. In addition, the medical costs for an overweighted person are on average 1,500 times higher than for a normal weighted person. Isn't it shocking? Hi, my name is Tizian Zapp, and I am part of the scientist research group of the CDC, the Centers of Disease Control and Prevention. First of all, I would like to thank all the parents for joining our today's meeting about informing and raising awareness about the severity of obesity, especially for our future generation, our kids. First of all, let's talk about the omnipresence obesity has all around the world, especially here in the US. One reason for this huge obesity rate are for sure the social and physical environment they are surrounded. They could, for example, live in a neighborhood where there are no sidewalks or there's a lack of safe bike trails. Therefore, they would rather use their car and go shopping or buy some food. They would rather use their car in order to go shopping rather than just walking, even if it's just around the corner. Their community, their homes, their school, their family, and their workplace can all influence the people's daily lives and behaviors, of course. Another reason for obesity is the low income some people have. Therefore, they are going to fast food restaurants because on one side, they are not having time to cook, and on the other side, they think that fast food is less expensive than homemade food. Don't you think that it's easier to go to McDonald's or Burger King and let you serve a good Big Mac menu rather than cooking on your own and do all the grocery shopping? Right? At first sight, it seems easier and cheaper. But to be honest, it costs more money to drive regularly to a fast food restaurant and let you serve a menu than driving once a week to a supermarket, do all the grocery shopping for 1 week, and you have some fresh food. It's cheaper. It's easier. Think about it. The easy way is not always the best way. And that's why it is time to say no to the couch potato. In order to prevent such dilemmas, the CDC is sponsoring all 50 states. Every week there's a different event happening organized by the CDC. We are not only organizing in big towns, but also in small towns. We are organizing there small groups who are doing physical activities or exercises almost every day. And that's for totally free. Can you believe it? For free. We want to motivate people by creating a unity that can motivate each other. Even if you don't want to join a group in order to get active. We are also offering you free training plans in order to get you a healthier lifestyle. You can do it with your friends, with your family, on your own, whatever. Furthermore, there are always nutrition specialists from CDC, one could ask for help or for advice. The appointments and the advice are for free, because it is well known that not everybody can afford these expensive specialists. Therefore, one can get, as already mentioned before, advice about healthy eating, but not only about healthy eating, but also about delicious food, because delicious food and its taste is so important if one wants to change its lifestyle. You cannot follow a diet if you are always starving and the food doesn't taste very good. Yeah, that's why we are offering our nutrition specialists. Here, a small example of the Wheel of Five, how one should eat every day. The most fruits, here's some bread, and there you can see a physical activity pyramid. There you see what you should cut down on. Watching television, being a couch potato as already mentioned. You should go out more often. You should go cycling, play tennis, play football, whatever. Just go out and get active. In addition, the CDC is in close contact with politicians, trying to lobby the government in order to prevent our future generation from being the unhealthiest one we have ever had. Isn't it shocking? We need to do something. Therefore, Michelle Obama is one of the supporters of our program, and Obamacare is supporting us too. Because Obamacare is giving people the opportunity to get an affordable health insurance in order to get adequate medical treatment in all cases. To make it a bit easier, let's watch a short video about how Obamacare works.
Let's talk about the Affordable Care Act, also known as Obamacare, and what it means for you. Say you've got private health insurance already. Maybe you have it through your job or your parents. Obamacare means you get a host of new benefits and protections. For example, insurance companies are now required to cover women's wellness visits, mammograms, birth control for women, immunizations for kids, all without charging you a penny more. That means no extra copays or fees. Young adults can now stay on their parents' plan until they turn 26. Insurance companies can't limit the amount of care they'll cover over your lifetime. Also, if your insurance company spends more than 20% of your premium dollars on overhead, stuff like CEO salaries, marketing, administrative costs, they have to send you a refund for the difference. In January, that list of benefits gets even longer. It will be illegal to charge you higher premiums or refuse coverage because you get sick or have been in the past. Charging women more than men for the exact same coverage, also illegal. No more deciphering page after page of jargony paperwork from your insurance company to determine what they will or won't cover. Instead, you'll get a short, plain language summary of your benefits and coverage. Easy, right? You can learn more at healthcare.gov. Okay, what about the folks without health insurance or people who buy coverage on their own? Here's what Obamacare has for you. A new, simple way to buy affordable, high-quality health insurance. Starting October 1st, you can go to healthcare.gov and use the new health insurance marketplace to see all of the health plans available in your area and sign up for the one that fits your needs and your budget. You can also find out if you're eligible to pay less for private health insurance or whether you qualify for other free or low-cost programs. All the plans in the marketplace are required to cover a core set of essential health benefits: doctor's visits, emergency care, prescriptions and lab tests, rehab for illness or injury, mental health services. They all come standard. Plus, all those benefits and protections available to people who already have insurance: no-cost preventive care, coverage for pre-existing conditions, accountability for insurance companies. You get all of that too.
So, let's make a little summary of what we've learned this evening. First, being obese means that you will get serious health problems and a shorter life expectancy. Heart diseases, diabetes, cancer could be some of the causes of death. The reason for obesity are mostly the social and physical environment, and the laziness of people going to fast food restaurants on a regular basis instead of just walking or cooking on their own. It is cheaper to cook on your own, don't forget that. Get help from the CDC Center or Obamacare if you need medical treatment. Get active and join our sports program, which are all organized all around the world, around the US. Last but not least, I would like to thank you for your attention, and if there are any questions, don't bother writing me an email. Have a nice evening. Thank you.